So this skill is emptying the contents of the resident's urinary drainage bag, and you have to measure and record the urine output. You have to be within 50 cc's of your evaluator. This is one of 4 documentation skills on the state skills exam. All right, everyone will be skill tested on at least one documentation skill. So make sure you're very familiar with all documentation skills. This is how this one will be presented. Hello, my name is Myra. I'll be your nursing assistant. I'm gonna go into your bathroom and wash my hands. And your name is? Miss Jones, nice to meet you. May I check your name band? All right, Miss Jones, I'm going to be emptying your drainage bag. Is that okay? Okay, I'm gonna give you some privacy and I will gather the supplies. So I will need 3 barriers, 1 clean, 1 dirty, and 1 to place my knees, because I am not allowed to kneel on the floor without a barrier. I will bring these over. This one will be placed here. And this one will be placed on the floor below the catheter. And this one will be placed separately from that. Miss Jones, I'm going to go into your side table. Out of the side table, I will grab the graduate. Out of the bottom drawer, out of the top drawer, I will grab an alcohol pad, and I will need at least 1 pair of gloves for this skill or procedure. Miss Jones, I'm going to raise your bed up so I can freely access that catheter. I'm going to place my gloves on. And I'm going to lift up your sheet, Miss Jones, just to take a look at the catheter. It is above the leg, free flowing, below the bladder, and not touching the floor. I will remove the nozzle from the holder. I will not touch this with my gloved hand, nor will I let the tip touch the edge or the sides of the graduate. I will open it, draining a considerable amount, if not all of it, for your state exam. I will close. Utilize the alcohol pad to cleanse the tip. Only time you're allowed to touch, and place it back into the holder. I will then bring this over and measure it at eye level. On one side there is ounces, and on the other there is cc's. This about meets the 550 cc mark. I'm going to check it not only for amount, I'm going to check it for clarity. Is there anything in it floating? I'm going to check it for color and even odor. All right, Miss Jones, I'll be right back. I'm going to dispose of this. And remember, it is 550 cc's. Place the urine in the commode. Rinse the graduate out. Dry it, just as we would the basin after a skill. And since we've utilized gloves, we will need another piece of paper towel to open up the drawer. Place the supply back in. Miss Jones, are you okay while I go dump this? All right, I'll be right back. Now we will dump this into the garbage. I will remove my gloves properly. I will wash my hands. State that for the evaluator. Miss Jones, are you comfortable? Do you need anything? Okay, great. Here's your call bell. If you need something, give me a ring. If not, I'll see you in about 2 hours. Would you like your curtain opened? Alrighty. I'm going to reduce the height of your bed. Prior to reporting or completing this skill, I must walk over to my documentation sheet, which my evaluator will provide for me. And on the documentation sheet, there is intake and output. We will document under output. We will put the time, it's 11:45. We will put the type of output, that is urine. We will put the amount in cc's, which is 550, our initial, and our signature. After doing so, you will turn to your evaluator and you will report, evaluator, there was 550 cc's of yellow clear urine, non-odoriferous, wash my hands, and I am done.